I'm Dr. Stewart Jessamine, and I'm the Director of Protection, Regulation and Assurance. Over the last 15 years, there's been multiple studies examining the effects of water fluoridation across regions in New Zealand. While the results of these studies vary from region to region, they consistently show significantly less decay in communities that use water fluoridation. The most recent New Zealand Oral Health Survey showed that children living in areas with fluoridated water had 40% less tooth decay. A recent Australian survey showed that adults living in areas with fluoridated water had 20 to 30% less tooth decay. This significant difference is consistent with international evidence where water is fluoridated at similar levels as in New Zealand. There have been numerous studies and ongoing analysis over the last 60 years about the safety of water fluoridation. We can confidently say from a medical and from a public health perspective that water fluoridation at the levels recommended in New Zealand pose no health risk whatsoever. There's no impact on IQ, there's no impact on bone cancer, there's no other major health consequences associated with consumption of fluoridated water at all. The only known side effect of drinking fluoridated water in New Zealand is mild dental fluorosis. This is a kind of mottling of the teeth that can really only be seen by dentists. There's been no cases of severe dental fluorosis reported in New Zealand associated with drinking fluoridated water. One of the advantages of having lots of research in this area is that you can do economic analysis. You can work out how much it costs to fluoridate the water supply and what are the health benefits. Water fluoridation is likely to save more in dental costs than actually it costs to administer the fluoridation program. A recent study by Saperi Research Group for New Zealand demonstrated that water fluoridation, by preventing dental decay, saves us about 1.4 billion New Zealand dollars over the next 20 years. That's mostly through decreasing the need for dental treatment. At a personal level, this will mean less fillings, less extractions, less kids having to go into hospital to get dental therapy. So this is going to save money both nationally and personally out of your own pocket. Saperi has reported that the average cost per person per year for water fluoridation is about $2.60. This is an incredibly small amount of money when you compare it against the average cost to an individual adult of one filling, which is about $250.